So the first cranial nerve is olfactory. This is not typically assessed. The second one is optic, which mediates vision. So first, I'm going to have you look at the Snellen chart. I'm going to have you repeat, covering one eye, the first three lines.
FPTOZ.
And then with the other eye, repeat the next three lines.
LPED PECFT.
Perfect. And then I'm going to test the visual fields with confrontation. So I'm going to have you cover another eye. And I'm going to hold numbers and you tell me what they are in each quadrant.
4, 5, 3, 2, 1.
Perfect. Now cover the other eye.
3, 2, 1, 4.
Perfect. And this is intact as well, so that's good for peripheral vision. Next is the ocular motor. So the following tests both cranial nerve 3, the ocular motor, and cranial nerve 2, the optic. So I'm going to look at his pupils. So his pupils are size 3. Next I'm going to do the direct light. Look at my nose. Perfect. And then I'm going to do consensual light. So shining his light in one eye, constricts both on that side. Constricts both on the left as well. Next I'm going to do the near response. So move this object near him, see his pupils constrict, move it further away. The next exam is for cranial nerves 3, the ocular motor, cranial nerve 4, the trochlear, and cranial nerve 6, which is the abducens. So these are also for vision, for extraocular movements. So I'm going to have you follow my finger. Good. I'm going to test for convergence. So move this object closer. And this convergence is intact. And then with the H test, with the following the finger, there is absence of nystagmus. And then there is absence of ptosis, so any drooping of the eyelid. Next, I'm going to test cranial nerve 5, which is the trigeminal nerve. And this is the looks at the jaw and the master. So I'm going to have you open your jaw side to side. Strength is intact for the motor part, and then the sensory part, I'm going to use both sides. So tell me if you feel this.
Yes.
So his soft touch is intact.
Yes. Yes. Yes.
His sharp touch is intact as well. Next, I'm going to move on to cranial nerve 7, which is the facial nerve. And this tests the facial nerve. So I'm going to have you raise your eyebrows, close your eyes, smile, puff out your cheeks, show your upper and lower teeth. Perfect, so the facial nerve is intact. Next, I'm going to test cranial nerve 8, which is the vestibulocochlear. So I'm going to have you put your hand on this ear. I'm going to whisper 3 words and have you repeat these.
Banana, squirrel, monkey.
And cover this ear.
Ice cream, love, summer.
Perfect. And then I'm going to assess cranial nerves 9 and 10. So this is the glossopharyngeal and the vagus, which are for the soft pharynx, the uvula, and the mouth. So I'm going to have you open your mouth. Say ah. There's no vesiculations, and there's no hoarseness or nasal quality to his voice. Next, I'm going to assess cranial nerve 11, which is the vagus nerve. Cranial nerve 11 is the spinal accessory. So shrug your shoulders. Good. 5 out of 5 strength. Turn your head this way against resistance. Turn your head this way against resistance. So 5 out of 5 strength. And then lastly is the hypoglossal nerve. So I'm going to have you stick out your tongue. So it is symmetrical, and there's no vesiculations.